Hi, everyone. We'll just give it about 30 seconds for people to join us. Okay, let's get started. Hello and welcome to the webinar, Movement and Healing, Learn and Experience the Benefits of Movement During Gynecologic Cancer Treatment and Beyond. I'm Kitty Silverman, and I'm the Uterine Cancer Director at SHARE.
And I'm Aisha McClellan, the Cervical Cancer Coordinator at SHARE.
Before the presentation begins, I'd like to tell you a little bit about SHARE. We're a national nonprofit that supports, educates, and empowers anyone who has been diagnosed with breast or gynecologic cancers and provides outreach to the general public about signs and symptoms. Because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, and our helplines, please visit our website at sharecancersupport.org.
We have a few housekeeping reminders for you. All participants will be muted during the presentation. Once the speaker finishes presenting, we'll begin the Q&A discussion. Feel free to ask any questions through the Q&A section at the bottom of your screen. Remember that the speakers are unable to give specific medical advice, so please keep your questions general in nature. We also have closed captioning available. You can enable this feature by clicking the live transcript button at the bottom of your screen and selecting the subtitle option. This webinar is being recorded. We'll share the recording in a few weeks with all of our registrants, and it will be added to the website. Now I'd like to hand it over to today's speaker to introduce herself.
Hello, my name is Shannon Armbruster. I'm a gynecologic oncologist at Virginia Tech Carilion in Roanoke, Virginia. I've been interested in cancer survivorship for my whole medical career, but really especially over the past 10 years, and have funding from the NIH to investigate cancer survivorship. So I'm honored to be here with you today and discuss a little bit about the benefits of movement during treatment and after as well. So I think the timing of this webinar is perfect, given that it's Gynecologic Cancer Awareness Month, and you see our purple ribbon up in the upper hand corner, representing the inclusiveness of this group of survivors. So thank you so much for joining us. I'll start with a brief introduction about myself, then we'll go into a little bit about the risks of physical activity or inactivity in cancer. What are the national guidelines for movement? Why should we move at all? And then a little bit about Dr. Harden's and my research together. So I have no disclosures, but I will say that I am biased in my opinions about physical activity and movement because it's a place where I really find joy and peace. So take everything with a grain of salt. I'll present the data to you, but I've also lived it myself as Dr. Harden. So just a moment about me. So I'm a GYN oncologist, and so I perform surgery, as you can see in the middle, with my very flattering protective eyewear and hat. But when I'm not performing surgery or giving chemotherapy, I do enjoy being outside and moving, whether that's up a mountain or doing downward dog at a beach or even just in my backyard. So I think it's important to keep in mind as we move forward that we all are individuals and we're not defined just by one thing. And so keeping a holistic view of ourselves is really important. So into the topic, there's clear and strong evidence that physical activity can lower the risk of certain cancers. And so you can see on the left-hand side of the screen that there are 8 cancers that can be lowered by being physically active. Similarly, sedentary behavior or sitting for long periods of time has been associated with a higher risk of certain cancers, specifically lung, colorectal, and endometrial. And what you may have noticed is that on both lists is endometrial cancer. And this sedentary and lack of physical activity is something that we see throughout the United States and is not just solely related to cancer itself. There was a publication back in 2018 that reported that only a quarter of Americans were actually meeting the physical activity and movement recommendations put forth by the national organizations. So it's something that everyone could really benefit just a little bit more from. So why do we think physical activity is related to cancer risk reduction? There's some data if we investigate the biologic effects of exercise on the body. And what we do know is that exercise lowers the risk of cancer development and progression through sex hormones and growth factor production, as well as by lowering insulin levels. It can also reduce inflammation and similarly improve the body's immune system that can help fight abnormal cells or different types of viruses that can cause infection as well. And we do know that being active can help prevent obesity, which is a major risk factor for several of our cancers. This schematic was put out by the National Cancer Institute, and it shows us that there's 13 different cancers that are related to being overweight or having obesity. And the two in the GYN oncology realm are cancer of the endometrium or lining of the uterus and that of the ovary. And we know that overweight and obesity are major issues that are plaguing America, with nearly 70 to 80% of Americans either being overweight or obese. So it's not a judgment or any type of criticism. It's just something that we need to be aware of and try to work together to improve our health. So back to physical activity. As with everything, when we're talking about guidelines or making recommendations, we need a way to quantify what that physical activity is. And so in the science or medical realm, we use metabolic equivalents, but to break it down on a very basic or childlike level, there's sedentary behavior, which is where on the far left, you see the little child just sitting inside this little circle and not moving. Light physical activity is where you're out and moving around, but you'd be able to carry on a full conversation without being short of breath. Moderate vigorous activity or moderate physical activity, on the other hand, is where our heart rate is starting to go up and we're able to let out short sentences, but not able to carry on full conversations. And that's in contrast to vigorous physical activity, which is where we're extremely short of breath and can maybe only get out one word or two. So using these definitions, it can help us to understand what exactly the American Cancer Society recommends in their guidelines. So they do recommend 150 to 300 minutes per week of moderate physical activity or 75 to 150 minutes of vigorous physical activity. Strength training should be done approximately 2 days per week. They also recommend avoiding inactivity, and this hits back at that sedentary behavior that we talked about. And so even if you're active for, let's say, 30 or 50 minutes at the beginning of the day, but you sit the whole rest of the day, there's still detriments to our health. So we have to be mindful about both of those things. And this approach and thoughts about sedentary behavior is a little bit of a newer area of focus. Hence, you might remember the slide earlier, there were only 3 cancers associated with sedentary behavior. And what we don't know is it truly only 3 cancers, or is this just a new area of research that we need to investigate in other cancer types as well? You might be thinking to yourself, oh my gosh, 150 minutes of exercise a week seems like a lot. And you're right. As I mentioned earlier, most Americans aren't meeting that recommendation. And so the American Cancer Society recommends starting slow and increasing the length and intensity of your activity. So if you're currently honest with yourself and you're like, I really just probably am active 20 minutes per week, that's okay. Set your first goal at 30 minutes per week and prove to yourself that you can do that for a couple of weeks prior to increasing the amount of time or the intensity of that exercise. I think it's our natural habit to go, well, I'm doing 20 minutes, so I'm just going to go for the 150. But we frequently aren't able to do that. Or if we do, we can't sustain those changes. And that can be really frustrating. So when you're thinking about goals for yourself, set a goal that seems attainable, and then you can keep moving along that trajectory and have more likelihood of sustaining those changes. I think one of the really important things that I took away from these guidelines when I first saw them is that all of your physical activity doesn't need to be done in one time period. One 30-minute block of physical activity is the same as 3 10-minute blocks of activity. So you don't have to dedicate huge portions of the day, but maybe can find time in our busy schedule for smaller sections to kind of provide the same amount of benefit. So the next kind of question is, well, like, where are we with weekly physical activity in terms of moderate to vigorous minutes per week? And this was a study that looked at individuals that had no cancer history or different types of cancer sites, as you could see listed at the top of the screen here. And as you can see across the board, no one was close to that 150 minutes of physical activity, regardless of age, you know, the top group being 40 to 64 or the bottom group being 65 to 79. So we all have a ways to go. Why is this physical activity important? Well, there's a lot of physical and mental and emotional benefits. There's benefits for our heart and our lung strength, our muscular strength, our stabilizer muscles that help prevent us from falling and having catastrophic injuries like hip or lower extremity fractures. It helps balance our body composition. It reduces the risk of having a second cancer. And it can also reduce the impact of other secondary medical conditions such as high blood pressure and diabetes. It can boost our immune system. And for some patients that are having difficulty eating, it can actually stimulate your appetite. When we look over at the mental and emotional impact, it is very, very impressive. There's improvements in quality of life, fatigue, distress, depression, anxiety. There's a boost in self-esteem, sleep, and even sexual function are improved, as well as brain function. So it's kind of crazy if you take a step back and think that we can have all of these benefits just from walking or moving our body. It doesn't need to be some high intensity, crazy gladiator type of workout. There's small things that we can do that can make a really holistic impact on our lives. The benefits of yoga, I'm not going to steal the thunder from Dr. Harden, but there's a lot of them. And I wanted to let everyone know this because you'll see later we've incorporated yoga and movement into our research, and there's good reasons for that. There was a recent study that was put out in 2022, also specifically commenting on the benefits of physical activity during cancer treatment. And they looked at the benefits of both aerobic, so kind of cardiovascular, as well as resistance exercise, more strength training. And what they saw is that there were reductions in fatigue, and then it helped preserve physical function, meaning kind of kept the heart and the lung health, as well as the physical function and muscular strength the same, and kept it from diminishing during treatment, which is really important because treatment can be really challenging, but the more that we can kind of help encourage the body to stay strong, the better our patients end up doing. Additionally, for some populations, there was an improvement in quality of life and a reduction in anxiety and depression. And again, I think this for some populations comes from the fact that not a lot of research has been done in all cancer types. And that's kind of the goal and the gap that Dr. Harden and I are trying to address. There's a little bit of data about physical activity and survival. There was a study that looked at all gynecologic cancer survivors, and those that had higher levels of post-diagnosis physical activity had a less likely chance of dying kind of from any cause than those who were the least active. For ovarian cancer survivors, if they were working out for over 2 hours per week prior to their diagnosis, they had increased survival rates compared to those individuals that were only exercising for less than 60 minutes per week. These studies beg a lot of questions: who, why, what is impacting them, what type of physical activity, how did it impact their treatment? And those things we just don't know yet, but they're things that are questions in our mind that we want to keep exploring because we know physical activity can be so powerful. This is kind of a backwards kind of graph, but I think it gives us a little bit of hope. So on the y-axis here, kind of on the far left-hand side, it's the percentage of cancer survivors and the time on the x-axis, or kind of the horizontal axis. And this graph is showing the number of survivors that are not exercising in their leisure time. And I think the really promising thing is that number is going down. Survivors are being more active in their free time, which is very encouraging, and getting closer to that Healthy People 2023 goal, which is 21%. But I think if you ask Dr. Harden and I, we would love our goal to be much closer to 0%. And so hence the push to help our cancer survivors. So on to our research. I do want to pause here just for a second, because I suspect that there are many different survivors with different cancer types who are on our webinar today. And again, thank you for joining us. Our research focuses on endometrial cancer survivors, but what we're really trying to develop is an algorithm for making interventions for cancer survivors in general. So what we're hoping to do is show that our approach works, and then be able to use it for other cancer survivors. So if you're not an endometrial cancer survivor, I'd love for you to just take a step back and listen to this, because this is something that could reach and impact you in the very near future, but we just have to start somewhere. So we chose endometrial cancer because it's the most common gynecologic malignancy, and it's very clearly related to having a little bit of extra fluff and being inactive. When we look at kind of where our survivors are at, there's different studies, but there was kind of one pinnacle study back in 2021 that showed that nearly 90% of endometrial cancer survivors were not meeting the physical activity guidelines. And they really weren't interested in doing strenuous or vigorous physical activity. And most of them really weren't interested in doing moderate activity either. And so that kind of data and that kind of information has actually been kind of parallel to what Dr. Harden and I have seen as well. Survivors are interested in moving their bodies, but sometimes just need to be able to find a safe way to do it first before pushing them beyond their comfort zone. That comfort zone is just is very important, and exceeding it can be quite uncomfortable. So kind of given this gap or this identified issue of lack of movement, well, then what do we do about it? Well, let's create an intervention, of course. Like, let's find a way to help our survivors get active. The challenge is that when we look at the literature, from idea conception to an interventional kind of program actually reaching participants, it takes 15 years. So all of our cool and innovative ideas at year one are maybe not quite as cool and innovative by the time we hit year 15. And so there's this gap between what we're providing for our participants and our survivors and what they actually need. So to address that, we use the obesity-related behavioral intervention trials translational model. Huge terminology, but ORBIT for short. And so this is the ORBIT model. I know there's a lot of text on here, but we'll just walk through that and just kind of briefly share where we are in the process following this ORBIT model. So the first issue is we have to identify our question. And so our question was, can we improve the quality of life of endometrial cancer survivors? And this question actually came from our survivors themselves. We performed survey and focus group kind of data collection, and we found out that survivors aren't interested in a primarily focused weight loss intervention. They're really interested in improving their quality of life, how they feel, having greater social support, and being connected with a group of researchers and providers that really care about them. But the idea of just a weight loss approach was just very kind of, it put them off. And so we also, once we kind of figured out what our aim should be, we then asked them, well, what components of an intervention would you like? And what they told us is that they wanted a remote intervention that could easily fit into their life and be adaptable to life events as they happen. And again, they would like social support and the ability to work out and do exercises at home and how they want to do them. And that they were also interested in a yoga and a mind-body approach as well. So then we identified a program called FitX that Dr. Harden has been spearheading for the past several years. And this is a physical activity, fruits and vegetables, mind-body intervention that's been available through 14 states across the United States, but has been used as an offer to healthy individuals as a way to prevent cancer and improve health, but hasn't been investigated for endometrial cancer survivors. So we adapted her program, given the feedback from our endometrial cancer survivors. And in short, the program is 8 weeks. There's a team captain who recruits family and friends. And so for us, that's our survivor gets to pick who they want to go through this intervention with, their family, their friends, their coworkers, with the idea that if we change the environment around the survivor, it's going to be more likely to have a sustained benefit for them, but also for their support team members. You may remember all of the statistics I gave earlier about inactivity and having a little bit of being overweight or obese across America. This program has benefits kind of for everyone in supporting each other as well. So these teams create a name and they set physical activity goals and kind of move through the intervention together. There's weekly newsletters that have survivor-focused topics, and those topics are discussed at a weekly Zoom meeting that's only 30 minutes and includes 15 minutes of physical activity and movement, and then 15 minutes of discussion and support group and kind of group cohesion. It was really important to us that we include yoga, self-awareness, and these mind-body principles into the intervention. And as you'll see in the next slide, we have collected pilot data that has really reinforced the need to do that. So we had a proof of concept study in the fall of 2021, and that's basically just seeing if there was interest from survivors and support team members to partake in the intervention. And we had a unanimous, yes, this is great. What is next? We are in. So that supported our movement into pilot testing. And what pilot testing is just trying to see, is there some type of benefit that we're getting from the actual intervention? And we're kind of mid data collection right now, but our data right now is very promising, showing the benefit of this intervention for improving quality of life. So our next work together, meaning Dr. Harden and I and our awesome team, is to put in a grant to the National Institute of Health through the National Cancer Institute to get funding for a much larger study with the goal of rolling this out across the country to have access for all of our survivors. I think one of the really awesome things about our project is throughout every step, we have had endometrial cancer survivor input in what has worked, what doesn't work, and what's important to them. And I think it's this unity that is just so special that, and I think that's what's going to make the difference of the long-term success of this program. And so because of that, I am internally grateful to our survivors and their support team members, as well as my mentors. Dr. Harden has been incredible and just a wonderful champion along the way, as well as our research team and our individual departments as well. So I appreciate everyone's time. And I also really appreciate Cher for giving us the opportunity to speak with you all today.
Thank you so much, Dr. Armbruster. That was very interesting. And now I'm going to pass it over to Dr. Samantha Harden, who will introduce herself and start her part of the program.
Thank you so much, Kitty, and thank you as well to Dr. Armbruster for sharing so much of our background and work. And for those of you who are interested in a little bit about my education and training, I have a PhD from Human Nutrition, Foods, and Exercise. I did a postdoctoral fellowship at the University of British Columbia in the psychology of exercise. And I'm also a dissemination and implementation scientist. So that piece that Dr. Armbruster mentioned about that 15-year lag time, there's an entire scientific process to try to shorten that lag time so that we can actually provide supports for our cancer survivors sooner. I've garnered over $29 million in grant funding and over 100 peer-reviewed journal articles. And I only share that because these are some of the things that show that I've been successful in my job, right, in this career trajectory. But then when we look about the person behind the science, I had a tumor in 2018, and it changed my life. There's so many components of becoming a patient yourself that are psychologically hard to deal with, physically hard to deal with, socially hard to deal with. You don't know who you want to tell, who you don't want to tell. And so I share this because, you know, as we're trying to use this science, I really like hearing the term me search. It's, you know, research, but it's me search, and trying to say, you know, what do I wish existed, and how can I be part of that change? So with that, I'll transition to sharing my slides, and we'll do a bit of experiential learning for my part of the program as well. So I'm really focusing in on the yoga principles and the experience, and a little less on the data, but I can definitely share about that during the Q&A as well. So a brief wrap up of what I kind of already shared with the bio is, yes, I'm Dr. Harden, but I'm also just a person trying to walk this lifetime and gather tools in my toolbox so that I can change the way I talk to myself when I'm not meeting the physical activity guidelines, when I'm not succeeding or achieving or doing these things that I think that the world wants me to do. And I can come back to the present moment so that I can flourish. And I think that yoga principles, particularly 3 of the 8 limbs of yoga, of movement, moment-to-moment awareness, and breath work, can really help us not just find energy, but also find rest, and then an ability to move with the ebbs and flows of life. And one of my favorite researchers is Dr. Brené Brown, who's a vulnerability and shame researcher, who has this quote that's pictured on the screen, that everyone has a story or struggle that will break your heart. And if we're really paying attention, most people have a story that will bring us to our knees. And I think that as people, as cancer survivors, you all are carrying those stories, and who you choose to share them with. Maybe it's somebody you've met through the Share Cancer Support Network. This is all about community and knowing that you are not alone, and really kind of breaking through some of that shame and some of those components that reduce our quality of life, that increase our blood pressure, our weight status, all of these different things, because we're just trying to navigate this news and information that we've received and the journey of recovery that it brings on, and the ebbs and flows within that. One of the principles of yoga that I really love as well is ahimsa, or nonviolence. And the way that I apply this with cancer survivors or with other populations, and really just all of us in general, is to meet people where they are. As Dr. Armbruster said, if we're getting 20 minutes today, setting up a goal or expectation that we're somehow going to find a spare 130 minutes just like that might be setting us up for failure and talking to ourselves in a violent way. Yes, violence is on a spectrum, but sometimes when we say we're not enough, we're not doing enough, that's going to have a lot of impacts on our body, as was mentioned earlier about inflammation and all these different ways that the body is responding to the way we talk to ourselves and the way we present in the world. And so one of the reasons Dr. Armbruster and I are so interested in bringing the mind-body component is because we want to work on, how we're treating ourselves, really being values-based, knowing that everyone's starting at a different start point. And, as was mentioned, do the different intensity or duration that serves you, and perhaps even embracing the you that showed up for the day. Because I'm a physical activity expert, and sometimes I don't meet the physical activity guidelines for Americans. Life is life. And so how do we continue to provide grace for ourselves and meet ourselves where we are? And all of this really relates to me in my new future directions of my research is to flourishing, which is holistic, personal, professional, and communal health, things that I think folks who are involved with Share Cancer Support are incredibly interested in. And on the right side of the screen, I've highlighted a couple of components of this article from the Journal of the American Medical Association that I love. And it says, clinicians spend time monitoring patients for adverse outcomes, and public health officials are looking at things like morbidity and mortality. But sometimes this really falls short of what you as a patient care about, like being happy, having meaning and purpose, being a good person, and having fulfilling relationships. And all of those are part of flourishing. Many of us have heard of burnout. We hear a lot about the negative side of things, but there is an approach to flourishing in your life. And as pictured on the left-hand side, it takes having a strong foundation, nourishment, sunlight, care, and not just thinking about treating one problem, because we are individuals within families, within communities, within our global society. So one of the ways that we propose that you can start to embrace flourishing is through yoga practices. And yoga, the root of yoga is yuj, which is a Sanskrit word for union, and that's with yourself, with others, and with your version of a higher power. And as we know, even through Share Cancer Support or through what Dr. Armbruster mentioned about having your support team members, we never have to do these processes alone. And that's what I think the yuj or union of yoga also means. And for those of you who are interested in our final few moments of my presentation, I'd love to guide us through breath work, moment-to-moment awareness, and movement. Please join as it serves you. I'll invite you to back up a bit from your computer or your iPad or your phone, whatever device you're using. We will be doing this from a seated position. So if you're lying down or standing up, feel free to do any variations that serve you, but it's all just an invitation if you'd like. So I'll invite you to find a comfortable seat. Maybe choose what that means for you. Is it planting the feet on the ground or sitting cross-legged? Is it leaning against your backrest or leaning forward, tall and proud? None is better than the other. Just choose what brings you to an intentional seated position. If you like, gaze 3 feet in front of you, or gaze towards the tip of your nose, or gently close your eyes if that feels comfortable. And start to intentionally breathe. Maybe through the invitation of stillness, you find some tension in your hips or your legs. Can you let your lower body relax against the supports beneath you, perhaps a chair or just the earth? Let the lower body relax. Let the belly be soft. Lift the heart towards the sky. Drop the shoulders down and away from the ears. And be gentle with you. Breathe deeply in and deeply out. If you like, stay here or one hand on your heart and one hand on your belly. And continue to breathe and notice if you're breathing into your lower belly or your heart a bit more. One is not better than the other. It's just letting you tune into you. Where is the fabric of your clothing pressing against your palms more? Or your hands can be down and by your side, or any other variation that serves you. Let's go for 3 more breaths without my cueing so that you can tune in and notice what you notice. I'll cue us on our 3rd and final long exhale. Perhaps part the lips and sigh out of the mouth if you like, or feel comfortable making it audible. Maybe it's even a huh or a ha, just letting the breath go and then dropping the chin towards the chest. Maybe keeping the eyes opened or closed, whatever serves you. And then bring one ear to one shoulder and stretch along the neck, perhaps a little bit across the front of the shoulder, in the chest as well. If you like, bring one hand on top of your head, and rather than pulling the head down, think about lengthening the head up and into the hand as you feel the tension between the palm and the head and the head and the palm, but more importantly, breathing in and breathing out. One more big breath in And on your exhale, release the hand from the head, drop the chin towards the chest, and take it over to the other side, one ear to one shoulder. Draw the shoulder blades down, create space along both sides of the neck. Stay here or bring the hand on top of the head and lengthen up and in. Let the heart be open. You might feel sensations of vulnerability, maybe some movement and heat even in the shoulders. Stay for the breath. Exhale deeply. Remove the hand from the head and stay here, tracing your collarbone with your chin, just going from one side to the other. If you like, keep this slow and steady movement with these half circles, or start to take full circles, gazing up, around, and back only as it serves you. If you take it in one direction, take it in the other. If there's a sticky spot, maybe stay there and breathe. Maybe bring your fingertips to your neck and give yourself a gentle massage or assist, or stay with the movement. We'll go for 2 more breaths without my cueing to notice what you notice. Coming back on center when you're ready, restack, head over the heart, heart over your hips. Inhale, swim the arms up and overhead, and exhale, drop one arm towards the ground. Stay here or reach the shoulder up towards the ear and then hinge to the side. Keeping length on both sides of our body, we're taking a one side lateral lean or stretch just to find some activation. Maybe you feel some warmth. Rethink about how grounded and rooted your lower body is, and breathe up, out, and over with your upper body. I can feel the echo of the blood flow in my arm. One more big breath. Tune into your sensations. And exhale, stay for the exhale, reach. Then use the strength of the abdominals to pull yourself up and on center. And then exhale, hands to the thighs, and notice what you notice. Maybe one hand is warmer than the other. There might be tingles or space or length. Just tuning into the sensations that are happening in your body. And on your next inhale, swim the arms up and overhead and drop the opposite fingertips towards the ground. Reach the shoulder up and then hinge and lean. Keep the throat open. Let the breath continue to flow and nourish your body. Breathe in and stay for the exhale, hinge. 1 or 2 more breaths, depending on the depth and length of your breathing as you stay. Inhale back on center and exhale, hands to the thighs. With the hands on the thighs, we'll take a couple cat-cows or flexion extension of the spine. So inhale, lifting the head, neck, and chest. This can be really small, almost barely perceptible, or you can call the chest forward. Then you can exhale and press the body behind you, maybe hammocking and wiggling into the low back. Often we feel so much tension in that low back. So then take this inhale and exhale, moving with your breath, or just like we did with the neck, staying in the position that works for you. And tune in, give yourself permission. Do you want to start taking hip circles? Do you want to go back to the neck movement? Are you called to something else? I'm merely a guide. Yoga is about tuning in to what it is that you need in this moment. We'll go for 2 more breaths without my cueing. And again, on your exhale, maybe parting the lips and sighing out of the mouth. Or a ha. So we've taken our lateral stretch and our front and back. We have 2 more moves to do all 6 movements in our spine. Inhale, reach the arms up and overhead. Exhale, you can cactus the arms and then twist. Keep your hips towards the front of your space and let the twist happen from the belly button and up. You do not need to crank the head, but instead let the chin go at the same depth as the rest of your spine. On every inhale, think about growing taller towards the ceiling or the sky. And on every exhale, twisting into the space you've provided. So think about your breath like an ocean wave, and you're lifting up and twisting in, lifting up and twisting in. Stay for 2 more breaths without my cueing. Back on center, breathe deeply in, and then exhale, take it to the other side for you. So keeping the hips forward, letting the move happen from the belly button and up. Does not have to be deep. It's all about tuning into the sensations as you inhale and exhale. On every inhale, rise up, and on every exhale, surrender and twist. Every inhale, rise, and every exhale, twist, feeling warmth in the shoulders, in the fingertips, perhaps. You can press the feet into the ground to find a little bit more anchoring. 1 more big breath in. And then exhale, come on center. Take any organic movement that's calling to you, and then we'll wrap with the hands on the thighs, stacking the head over the heart over the hips. I like to lean back for this final moment of our guided visualization, so feel free to find your back rest. And if you like to continue to engage the abdominals and sit up, feel free to do that too. And I'll invite you to find 5 distinct colors that are around you, maybe moving the eyes up, down, and around, activating the 6 muscles holding the eyes. And once you've found all 6 of those colors, maybe find a slight smile and gently begin to flutter the eyes open, or flutter the eyes closed, or find a soft gaze in front of you. And then tune in and find 4 things you can hear. Maybe it's the sound of a ticking clock, my voice, your own breath or heartbeat, maybe a dog or a loved one in another room. We're all just humans having plenty of distractions. Call all 4 of those sounds into your mind. And if you like, saying a gratitude for your senses. Breathe deeply in and deeply out. And find 3 things you can feel. Maybe it's the fabric of your clothes, the temperature in the room, the weight of your body against the supports beneath you, or something else entirely. Breathe deeply in. Perhaps parting the lips and sighing out of the mouth. Finding 2 things that you can smell. Maybe it's even your own warm breath from your exhale. Maybe it's a scent that you would like to call to your mind's eye and just remember a scent that brings you a sensation of calm. Breathe deeply in. Part the lips and sigh out of the mouth. Maybe take a big swallow or run your tongue along the enamel of your teeth and either taste one thing or call to mind's eye one thing that you like to nourish your body with. Maybe it's a dish from your culture or for special celebrations. Breathe deeply in and deeply out. Tuck the chin towards the chest in gratitude for the sensations and the depth of your practice, for taking a few moments for you. We can only give from our overflow, and opportunities to find movement, moment-to-moment awareness, and our own breath can help us be better people on and off the mat. If the eyes are closed, gently flutter the eyes open, taking in the colors and sensations of the space. And I welcome you to lift the head, neck, and chest and welcome back to the present moment. I hope you had a nice opportunity to experience yoga if this is not in your normal practice. And we're here to answer some questions as well. Thank you for having me.
Thank you so much, Dr. Harden. That was really wonderful to experience that. And we really appreciate your sharing that with us. So we're going to start the Q&A. Thank you to everyone who pre-submitted questions when they registered, and you can still submit questions now in the Q&A section at the bottom of your screen, and we'll try to get through as many questions as we can, but we may not have time. We may not be able to get through all of them. So it sounds like there are so many different elements of what you can do to exercise: yoga, cardio, strength. And I guess one question that just came to mind from listening to you both is it's just best, I guess, for each person to kind of come to what works best for them. And I know cardio is very important. And actually somebody did ask, are they okay to just walk every day? Should they wait in between? And I know the same is true with strength training. So just kind of what do you think about the mix of all of these different, facets of exercise, awareness, like yoga and mindfulness?
I could start. I think that the awesome thing is that because there's so many different types of activity, you can really, as an individual, pick what fits into your life and what you enjoy doing. I think we as humans don't like doing things that make us uncomfortable or that we don't derive some type of joy from. So, a balance of cardio, but the great thing about cardio is that could involve many different things. That could be swimming, that could even be gardening, that could be walking. So within each kind of those realms, even in terms of yoga, there's hot yoga, Dr. Harden can elaborate into that, but there's many different kind of ways to kind of hit each of those three buckets. But for the most benefit, we do like trying to think about pulling something from the yoga mindfulness bucket, the cardio bucket, and then the strength training bucket as well. There is some thought about giving yourself a day between strength training, especially if you're strength training the same type of muscle groups. And it's never a bad thing to walk every day. That's totally fine. But if that time could maybe be used for a little bit of strength training, then that's kind of where the give and the take and the ebb and the flow can be as well.
Thank you.
I certainly echo that. And I think one of the words that I really like is multi-component physical activity. So, we want to give our body variety because each different type has different benefits. So we need heart health, we need lung health, we need fall risk reduction, we need stress reduction, we need hormone balance. And so by having a variety and getting it, the Department of Health and Human Services has an entire campaign through the CDC called the Move Your Way campaign. And so it's like, it doesn't matter how you're getting there, but the intensity and duration is going to be based on you. Some of you may have heard of HIIT, high intensity interval training. For some bodies, walking to one end of a room and back quickly can be HIIT. For some bodies, they're jumping around. And so some of the gateway into physical activity is leaving what you think you know about it and just finding something else that works. It's not it for those who love their 5 a.m. gym time. Bless you, enjoy, keep going. For those of you who are like, I'm just trying to get 3 10-minute walks within my day, that is absolutely wonderful as well. So I think just to summarize on what I'm trying to say is multi-component is best, variety that works for you anytime, anywhere.
Thank you so much.
Yes, thank you.
Can I add in just one extra thing? I think one of the other things to keep in mind too is that at different points along your survivorship journey or your life journey, there's going to be different needs. And so there might be times where your stress is higher. And so it's okay to lean into the yoga and mindfulness during that time, or whatever type of activity fills that goal for you. I think that if I look at my physical activity now, it's much different than it was 5 years ago. And that's okay. And that's actually a really good thing because I'm aware of my body and what my body needs.
That makes a lot of sense. Thank you.
Yes, thank you. So the next question is, what exercises can you do if you have sarcopenia?
So, if you have sarcopenia, I would recommend making sure that you're consulting with your physician because there's different levels of sarcopenia. And so any type of movement, whether it's lifting your arms or lifting your legs, as long as that's safe and you're able to do that. But anytime we have physical kind of maybe barriers to certain types of exercises, it's really important to involve your healthcare provider. And we're always happy to give individual recommendations as well to make sure that you're getting your individual needs met.
Yes, I absolutely love that suggestion of speaking with your healthcare provider because they're going to know a lot more about your situation. And as a public health individual, I would like to share too, because this question was for sarcopenia, but maybe if others are on the call and they have arthritis or osteoporosis and all of these things, in fact, physical activity is one of the ways to mitigate or prevent any of these things. And it's so hard to wrap our minds around when we are feeling fatigued or cramping or in pain. But the more we move, particularly for sarcopenia, we're going to increase our muscle density. That is also going to relate to the bone strength. Like it's, again, that multi-component can start to have that bidirectional benefit for you, no matter what chronic condition you have. One thing I like to share with folks is individuals with spinal cord injury are still encouraged to get 150 minutes of aerobic activity and 2 days of full body strength training. They just specify the type of activity they do. And I share that because of some of the work that I do with SCI Action, Spinal Cord Injury Action in Canada, is that when we say move your way, we really mean that. This is an inclusive practice, and something as simple as doing abdominal contractions can give you some of these hormones that we need to increase our longevity and our health. So absolutely speaking with someone to get tips and tricks for all of the things that you're facing, but no matter what you have, know that more movement is better for everybody. I have yet to find a population that more movement is not good for them.
Thank you very much. Actually, I think you also just answered one of the next questions where they were asking about scoliosis and stenosis, because I'm sure a lot of what you just talked about impacts that as well. This is a question about the research, actually, that somebody submitted live. Do you have any kind of control group in this research?
We do. Our current study does have a control group that received kind of a one-time newsletter as well as a Fitbit to help monitor their health. We also have a FitX group that does not have mind-body principles as well. So it's the same intervention, but just with the physical activity and fruits and vegetables focus with the team, but there aren't those mind-body principles and movements built in.
Thank you.
Thank you. Yes. So another question we got that just came in, can the definition of light versus moderate exercise change depending on the individual? For example, I get tired quite a bit during treatment and can be out of breath when I walk rapidly.
The definition is definitely fluid with you. And at some points, it's harder for our bodies to exert different levels of physical activity. And so during treatment, moderate might just be a really slow walk. And when you're off treatment, it might be a more brisk walk. And so that's a really great point. I'm really happy that someone brought that up. And it's also giving yourself grace during those periods that you're still moving and you're still having benefit, even though what you're doing might be different at different periods in time.
And one word for that is your relative intensity. So even if you're taking a class with a group of people and we're saying, okay, this is moderate, it might be vigorous for some, but we kind of teach to the middle, but it's, for you, you can kind of take that graph that Dr. Armbruster shared and think, where am I on this intensity level? So it's your own RPE, or rate of perceived exertion. You want to stay at the range that feels good for you during treatment and beyond.
Thank you. How many times a week would you suggest weight lifting, weight bearing exercise?
Recommendations are for 2 times per week if you're able to do that. More is encouraged, but kind of 2 is kind of that threshold that we would kind of shoot for.
And just as the quality of life, depression, sedentary time, all these things that Dr. Armbruster mentioned are less studied. For some reason, some of the data for strength training is not as well studied. And so if you really dive into the full 200-page physical activity guidelines for Americans, the recommendations are 2 days of full body. And so sometimes it's like, well, is that 30 minutes? Is that 60 minutes? Is it 75 minutes? It just says hit all the major muscle groups, which is lower body, upper body, core, and back. And so it depends on how you want to do that, because if you only do your lower body on Monday and Wednesday and upper body on Tuesday, Thursday, you might be doing weight bearing or strength training exercises more frequently, but you're still getting the 2 days of full body. So some of these recommendations are kind of hard to dive into. And I think that speaks to Dr. Armbruster's recommendation of, speaking with a healthcare provider, maybe even your own, physical therapist or a personal trainer or someone with credentials who can, I guess this is my shameless plug of, maybe not the influencer on, social media who doesn't have a background, because they might be saying something and it's based on their experience, which is wonderful data. Subjective data is wonderful, but it might not be really generalizable.
Thank you.
Thank you. Are there certain exercises to avoid if you have a port?
That's a great question. And it really depends on where the port is placed and kind of you as the individual. If you're moving your arm and your shoulder and you're experiencing discomfort in that port area, then I would avoid those type of activities. And also, again, reach out to your healthcare provider or, again, physical therapist, and they can try to help maybe see if there's different types of movements that could target the same muscle groups, as well as sometimes help to make sure that your port is kind of laying flat and in the right place. But I would definitely listen to your body and make sure that if you're feeling something pulling and tugging that doesn't feel right, then I would stop.
There are a couple of questions about recurrence, and I'm going to kind of put them together. How much cardiovascular activity, specifically the kind that produces high heart rates, and I know you did talk about this somewhat, is helpful to reduce recurrence, and also can losing weight prevent a recurrence? Right.
Those are very great questions, and they're questions that we really don't have prospective data to answer. But that is part of Dr. Harden's and my mission, is to start collecting that data, to start building these repositories and tracking our survivors long-term to see what those long-term benefits are. We do think, and there are some kind of preliminary data, that if we're exercising more, we're healthier and we're living longer. But specifically related to recurrences, especially for endometrial cancer, it's challenging because the recurrence rate isn't all that relatively high. So it's a very challenging. We need to follow a large group of survivors for a large period of time for us to have those answers.
That makes a lot of sense. Yeah, thank you. I think we have time for Aisha to ask one more question.
Okay, there's so many to choose from. How do I pick the last one? Are there specific kinds of exercise that I should avoid during cancer treatment? What about after my treatment is complete?
I think the world is really your oyster. I think that I would, if you're looking to start physical activity and haven't been active before, then I would start with a lower to moderate physical activity and see how your body feels. And if it feels easy and you feel invigorated, then it's okay to push yourself a little bit more. But if you haven't been involved in physical activity, I wouldn't necessarily start with like jumping jacks at high intensity, because that your body isn't used to moving in that way. And that might not feel quite as good as starting with a little bit of a lower intensity. And I think similarly, after you've finished treatment as well, it's really listening to your body and thinking about what might feel good and giving things a try, and also acknowledging that you're going to try to do some type of physical activity that you just don't like. And that's okay. There's other options as well.
Awesome. Thank you, Dr. Armbruster and Dr. Harden, for an informative program. And thank you for all of you for participating and submitting questions. Make sure to check out SHARE's website for upcoming educational programs and support groups, including our annual gala, the second helping of SHARE, being held in New York on September 21st. And also don't forget to follow us on social media.
And thank you again to both of you. And please take a moment to fill out the survey at the end of the webinar. The survey will show up in the browser when the webinar ends, and the link will also be in the follow-up email. And all surveys are anonymous. And this concludes our program for today. Thank you so much to everyone for joining us, and to our wonderful speakers, and have a great rest of the afternoon. Bye-bye.
Thank you.
Thank you.